One group that needs special care in the COVID-19 pandemic are the elderly. This is due to their vulnerability because of many ailments commonly associated with aging. Joining me now to discuss how to care for them at this time is the medical doctor, Olutoyin Ajala. She joins me from London via Skype. Thank you for joining us on TVC News at 10, Dr. Ajala. I must say it's a really great work those on the front line health workers are doing at this time to stem COVID-19. Share with us your experience caring for the elderly in the face of the pandemic.
Oh, hello. It's lovely to be with you. So, as you've rightly stated, the elderly are the vulnerable group in this pandemic. You've stated earlier on in the program that out of the more than 3 million people that have been infected worldwide, more than 1 million have recovered. Now, unfortunately, the elderly don't come into that group commonly. What we found is that the rate of death in elderly people who are infected with the coronavirus and develop COVID-19 is disproportionately higher than any other group in the population. So if you have, for instance, in the younger age group, a death rate of less than 1%, in the older age group, you're looking at up to 20% death. So COVID-19 is just a dangerous illness. It's a dangerous disease for older people. All right. Anyone over the age of 65, yes.
All right, and that's quite touching. Now, a number of people have elderly ones at home, and this period of lockdown especially, it's been difficult to either get to them or to be able to comfort them, the fact that they have to be indoors all along. How do people like us care for the elderly in times like this?
Unfortunately, in times like this, the best way to protect your elderly relative is actually to stay away. So what the federal government implemented and the state governments with the lockdowns and quarantine, that was actually a very good move for the elderly. Now, as a geriatrician, I would tell you, if we spoke last year, I would be advising that, all my elderly patients, clients should be having an active social life, because we know that social activity is good for the overall health of elderly people. But in this coronavirus period, and with the risk of infection, and the high rate of death with elderly people being infected with COVID-19, the most important thing really would be to try and stay away and maintain some kind of contact with them via technology, the phone, FaceTime, video calling. That's the best way at this time until we can actually see the state of play, especially in Nigeria right now.
All right, Dr. Olutoyin Ajala is a geriatrician. She joined us via Skype from London. Thank you for talking to us, Dr. Ajala.